Welcome, 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 and thank you for joining Straight Grown Talk. I am your host, Laquel Farley. Today we have a segment that's called Let's Talk About Therapy. I have three phenomenal young adults in the building that's going to share some knowledge with you about therapy. So momentarily we'll be bringing them up to get to some serious business and learning about therapy. But before we get started, as usual, I have to give thanks to our sponsors, everyone that support the show. Again, Straight Grown Talk is a community-based show. This show is for you. It is to educate you on topics that's designed for the community with people that are trying to live extraordinary lives and doing their best to provide the best for our community. So as you can see on the ticker that's running at the bottom, it'll give you information on how to reach me. But also at the top, we have some flyers and information on special people that are doing special things in the community. Again, I want to thank our sponsors. And in a moment, we'll be right back with the three phenomenal guests I have today to talk about therapy. Can't wait for them to come on. See you shortly.
Kipland Real Estate Consultants and Advisors is a different type of real estate brokerage firm. From our educational materials and workshops to our expertise in handling complicated real estate matters such as foreclosure, short sales, probate, divorce, and other stressful issues, we are the innovators in the real estate industry, offering specialized services. Whether it's property management, buying your new home, investing, or simply a distressed homeowner, let Kipland Real Estate Consultants and Advisors help you achieve your real estate needs.
Hi, everyone. As I told you, we'll be right back with the topic today regarding Let's Talk Therapy. And today I have three phenomenal special young adults that are here to share with the community their viewpoints and what they do every day in life about therapy. So I'm going to let them introduce themselves, and we're going to get started right after that. So we're going to start on this end.
Hey, you guys. My name is Barris. I'm a physical therapist. Been doing it for about 6 years now. What else y'all need to know about me? Yeah, go ahead.
Right. I'm Latoya Roberts. I'm a speech pathologist in Atlanta, Georgia. I've been working almost 9 years, and I work in all settings.
I'm Kurt Wright. I'm a certified occupational therapist assistant. I've been doing it for 4 years. It's a great field.
Okay. Thank you for introducing you guys, yourselves. And we're going to jump right into my first question is going to be, what made you choose the field in which you went into? So I'm going to start this way this time.
All right. So originally what I wanted to do was actually work in sports medicine, be a physical therapist. But my sister began this journey in her life first. She told me about it, and I felt like I would be great at it. As an occupational therapist, we help people from infants to geriatrics with their day-to-day lives. So everything you do from the time you wake up to the time you go to sleep, we help you do that as independent as you can if you have a mental or physical disability.
Ms. Latoya?
I knew I wanted to work with children, so it allowed me to identify my passion in the realm of speech pathology. My mother's friend, Ms. Neville's, alerted me of the field, so I did research, and it kind of instill a firm understanding of what speech pathologists do and looking at etiologies and characteristics. And over time, I just knew that this field would have longevity. We can work in all settings in any state. You're not limited. And so I really, I believe children is how I started, but now I work with the geriatric population as well.
Okay, Ms. Burris.
Initially, I actually wanted to do medicine, so I was in school for pre-med for about 2 or 3 years, and I just lost all passion in it. I was actually shadowing a physician, and I noticed right away he wasn't really spending much time with patients. So I kind of did my research, and I found out about physical therapy. And when I started shadowing my first therapist, the one thing that stood out to me was like, this person's spending 45 minutes hands-on with a patient, and that really took it off for me. I knew this is what I wanted to do, so I pursued it, and here I am now.
Oh, wow.
Yeah.
Now, I want to go into details about what you guys do, and I'm going to start with Ms. LaToya in regards to, tell me about speech therapy and what you do.
I currently work in all settings except home health. So as a speech pathologist, you may work in the school system with children of articulation, language, and fluency disorders. Many of your children may substitute sounds. They may stutter. It depends on what their disability is. I think people think if children receive speech therapy services, that means that something is just wrong with the child, and that's not the case.
Yeah, because that's a stigma that they have given us all along.
Yes.
And unfortunately, that's not the case.
No, ma'am.
A lot of times, the kids need just that little bit of push to understand different sounds, or they might be a little bit slow in talking or getting a concept of something. So that's why I wanted you to kind of explain that more in detail.
Some parents don't allow their children to attend daycare very early on, and so they don't have the interaction that they need to acquire letters and sounds and to be able to put 2 words and 3 words together. So a lot of time, once they enter school age, kindergarten, they immediately think, oh, this child is not talking, or this child, cannot communicate their basic need, and that's not the case. They just need the skill set, and they need the strategies to be able to produce language. Some of our children actually may require private practice services, because in the schools, a lot of them receive what we call group therapy. And we know that some people don't benefit from working in a group. You may need that one-on-one.
Correct.
I also work in skilled nurse facilities with patients with neurological, that maybe they had a traumatic brain injury, maybe they had a CVA, which is a stroke. Maybe this patient had cancer, and they have now lost some function in the physiology of their swallow. So some of these patients may require speech therapy services to work on how to communicate. Maybe they have paralysis on one side of the face. So we help them learn how to develop those motor skills to be able to put the sounds together. Maybe your loved one has dementia, and they have now cognitive deficits. Unable to remember. We know short-term memory is the one thing that our patients may be unable to recall what happened in the last 10 minutes, the last day. Some of our patients, as I mentioned, may have had cancer, and now they've lost swallow function. So we work on oral motor exercises with those patients, as well as a loved one who may be NPO, nothing by mouth, or, as we say, those nasty thickened liquids.
Right.
And we try to progress them to a better diet. And there's no feeling than not being able to eat or swallow, or having to tolerate a diet that you're not used to. Or some patients say, I want to go back home independent.
Okay.
I need my medicine management skills. Or they
So
say,
do you follow them at home too?
we don't, but what we do is we refer them for home health services, and another speech pathology will come in.
Which is
and
a continuation of therapy.
continue
Okay.
therapy. And same thing in hospitals. It may be a little bit more intense in hospitals because they do have all of the doctors are there, all the disciplinaries. You have the respiratory therapists. So there's just so many more people on the team in the hospital.
Okay.
So it's a lot. It's a great field, and there's so much to do. You're never bored.
That's a good thing. So tell me, how does physical therapy work? We hear that all the time, and and we hear that all the time, and I want to know a little bit more about physical therapy, the pros and cons of it.
So primarily the idea is that we want to return patients back to their normal function. So that's really the primary goal for physical therapy. I'm more so concerned about somebody's physical capacity. So can they walk? Can they go upstairs? Can they move around the way they were moving before they had either their injury or their stroke? So I guess to differentiate between sort of what speech therapy does, there are physical aspects to what a speech therapist will do, but I'm more so concerned about can they just get back to their level of physical mobility before they had their injury.
Okay. Now, is this also for elderly people as well?
Right.
Because
So
I know y'all use the terminology, what is it, geriatric?
geriatric.
Okay, so for our community, can we say seniors? Or
Seniors.
Break it down. We
There
need
you
to
go.
really break it down.
Them old folks. Yeah.
Right.
We work, across the scale. So again, anyone from an infant up to elderly age, we work with any patient because people have different issues, regardless of what age they are. But it tends to be that older folks tend to have more problems as they age. So that's primarily the population I work with. But if you can be an athlete and injure your ACL, you're likely going to have to see a therapist at some point to get you back into game function, So there really isn't any limitation in terms of the age range that we work with. We can work with anybody. As long as there was an injury and they were hurt and they need to get back to function, there's something we can do to sort of supplement and help those folks.
So what are some of the things you do to get them back on track?
Right. So it really depends on the injury. Before I started working here in Atlanta, I worked in New York in a hospital for about 3 years, and I worked with patients who were post-op cardiac surgery. So our main goal was to get these folks up and out of the bed as quickly as possible, sort of protect their surgical area and still get them moving because we still had to work their heart. Right, so we had to find ways and strategies to get their heart pumping, the blood flowing without re-injuring them. So that was really a challenging population for me. But I was working with folks who were 22 who had heart surgery, and I was working with folks who were 75 who had a triple bypass. So so it was a lot of complicated things going on, a lot of tubes and hoses and all kinds of things connected to them that you had to watch out for. But you still had to get this person up and down. And if you had a patient who at home they're going up 20 steps every day, I had 3 to 5 days to get them back to their original function and still be protective of their injury. So we have to find really creative ways to get activity back into these folks without re-injuring them.
Okay. I heard you mention about time. Is that a time limit, or that's what the hospitals give you as a time limit, or?
So there are, it is a lot of factors that go into the time frame. So an insurance company may have an average range of time that they anticipate a particular patient, given their age and their injury, that they'll get back to function. And more often than not, those ranges are reasonable, right?
Okay.
So presumably, for instance, I had a patient who's just day one post-op bypass surgery. The assumption is whatever blockage or issue they were having with their heart, that issue's been addressed surgically.
Correct.
Right? So there really shouldn't be much of an issue to get them back to where they need to get to. But at the same time, it was a major surgery.
Okay.
So the bigger issues more now is like, you just had your chest cut open and you've got staples keeping it together, right? So I have to find a way to get you back to what you were doing before without re-injuring you. Okay. So it's
Definitely
not that
focus on
patients are now
endurance.
limited. The assumption is you're back to what you can do. We just have to find, we have to find strategies to get you going. So those time frames generally are rational. They make sense, and they don't necessarily. It can be complicated. Is a lot of factors that go into
Right,
this.
it varies.
Yeah.
Depending on their diagnosis, depending on what we have to do to reach their outcome goals, that factors all into the time.
Right.
Okay, well, since you are talking, let's do occupational therapy. Tell me what that looks like.
So I'll try to give you a snippet of what occupational therapy is, because our field is vast, extremely vast. Like I said, everything you do on a day-to-day basis, from the time you wake up to the time you go to sleep, from brushing your teeth, dressing yourself, getting up, going to work. How do you get to work? How do you drive? How do you hit the pedals? How do you, if you have the awareness to hit that brake to stop? Once you get to work, ergonomics, make sure that the job fits for you. Once you go home, how do you have your leisure activities, your entertainment activities? We go into every vast aspect, every specific aspect of your life to figure out, all right, what's safe for you and what makes you independent so that you can do it on your own. And that's how we focus. What is safe for you, and can you do it independently? If you can't do it independently, then we find a way. Just because you have an amputation of your leg doesn't mean that life is over. Okay, we teach you how to dress yourself, how to get in your wheelchair, how to put on your prosthetic, how to get up and go live your life the way that you want to live it. So it gets deep. It gets deep because we get into your finances, we get into your child's life as well as your life.
Wow, as an occupational therapist?
Because again, what is important to you is what we're going to work on, what we're focused on. So whatever is important to you, we get into your life, we make sure that you can do it as functionally and independent as possible, and we go from there.
Okay. So tell me, if you had to go to work today, what will be your day-to-day today of some things that you do with a patient? And you can use a general patient that doesn't have a problem.
So right now I work in a skilled nursing facility. These are more low-level patients. In other words, they need somebody to take care of them, a nurse, full staff to make sure that they get their meds, they go through their day-to-day life. In this certain setting, they don't really leave the facility, so we bring in all entertainment for them. Okay. So a day-to-day life would be getting a patient up. If one of their goals is dressing, then every day we work on dressing. We make sure that they can dress themselves so they don't have to depend on anybody. In that specific setting, our main focus, our first focus, is toileting. You know, you definitely don't want nobody to change you. You don't want to have to wait for somebody to change you. Yeah. You don't want to sit in your own mess. Dignity. So we will get you up every day. We'll transfer you from that bed to that toilet, help you with your clothing until that you become safe and independent where you can do it on your own. If I was working in a setting that I worked in before, an independent living facility, then our focus is to get you back up to your day-to-day. What do you do? I mean, you got a 70-year-old who still trades stocks, but he had a stroke. So again, we're into your life. All right, so let's set this computer up. Let's see how much you can do. First, we're going to focus on that hand function. We'll definitely bring speech in, focus on that cognitive function. We'll bring PT in if we need to focus on that mobility function to make sure that if you have to go to your job, you can get there and you're able to perform it to the best of your ability. If you're not, then we find a way. If you can work from home and have a laptop, we'll do that. If you have to do what's called the sheets and stocks, where you just pencil right in what stock you're going to do, then we'll do that, and we'll make sure it gets to the proper place it needs to go.
So about how much time would you say on an average that you spend with a client?
Used to be an hour. It used to be an hour a day, 5 days a week. We try to get it to 6 days if we can, give a good justification for insurance. Now it's being broken down to about 45 minutes to 30 minutes due to some insurance changes. But that hour, it's so good because we can do so much in that time frame of an hour. Every day we have a specific goal, and we're going to reach all those outcomes, especially with the window of having 3 months to do it in. Even if it's 20 days to do it in like it is now, we're going to reach it.
Okay. As a whole, I hear everybody say that we recently went through some insurance change. I want to address on those issues just a tad bit, and I know you guys really can't harp on it, but explain, and someone can take the lead on this, what you meant about some of the cutbacks.
Oh, y'all gonna put me on the chopping block? Okay.
He had a clear picture what happened.
So what's changed? We used to be on a system called PPS, and now we're on a system called PDPM, which is patient-driven progress. What's it? Patient-driven.
Don't ask. No.
Okay.
Okay, so we're on this system called PDPM, and what it does is it takes our time from that hour that I spoke about, where we used to be able to get everything done in, and we're down to 35 to 45 minutes. So it's taken away that time for patient care, because the way the model is set up is that if the patient has this diagnosis, if they have this cognitive level and this functional level, they should reach this outcome goal within a certain amount of time. This puts everybody in the same category, which is definitely not true for anything. You can't say that a 20-year-old or a 30-year-old, 40-year-old, 50-year-old, 60-year-old is going to reach that goal in the same amount of time. And you can't say that my 34 and his 34 is going to reach that goal with the same amount of time.
Correct. Because
So
everybody's different.
Everybody is different. But that's what we're working off now, where it's if you're this age, this diagnosis, this functional level, this cognitive level, you should be able to reach this goal in 20 days. And that's really unsafe because
It's pros and cons.
it is pros and cons.
Okay, so what are some of the the cons?
So one pro would be, if it keeps therapists honest, right? So if I'm working with a particular population and I know that I have this short window of time to get things done, I'm more apt to give every effort to get this patient at this level, right? And we know that outcomes are driven, particularly with certain diagnoses. The quicker you get in there and work with these patients, the better the outcomes long term. So there is evidence to support that.
Okay.
The con is like Kurt said, it's there's no patient's ever going to perform exactly the same as any other
Exactly,
patient.
right.
There could be circumstances that are completely outside of my control as a therapist. So if I'm working with a patient who's homeless, that completely changes the dynamic in terms of what
Right, what we're going to focus
right,
on.
what we're going to focus on, right?
Yeah.
So, it's complicated. I don't know how to really explain it in any better terms than that, but it's definitely
I
complicated.
think the con is, I know from a speech standpoint, I have patients, and for example, if you have a cognitive deficit and a swallowing deficit, and I'm only allowed to treat you 30 minutes a day, 5 days a week, and you are NPO, nothing by mouth, and I'm expected to return you to a regular diet, thin liquids, within a matter of
20 days.
20 days,
yeah, 20,
when I'm
30
only
days,
working
yeah.
with you for 5 days, and
Oh,
you are
wow.
nothing by mouth, meaning you can't swallow, you can't elicit, you don't have that hyolaryngeal elevation. You don't have any of that, and I'm supposed to help you achieve this goal of returning back to regular meats, thin liquids, and to be able to tolerate that 3 times a day, and to meet your nutritional needs by mouth, as well as we don't think about pills. We know pills can be very hard to swallow. You were someone who was independent.
So do they give you guys some room, or they're saying we're not going to pay after this time because we've already said this is where the patient should be? As you guys just said, no one is on the same level per se. It's based upon that individual. So with that being said, are they giving you guys some wiggle room, or they're just saying it is what it is?
The wiggle room would be if we can justify it to give them another week.
And
Another week.
And
if-
you have to
if.
have strong justification. And it's not even justification. It's pretty much saying your diagnosis has to show something else has occurred. Something is impacting where you are right now. Honestly,
Yeah.
this is just where healthcare is right now, and it's very sad, to be honest. But this is where we
So
are.
it's a bundled payment, meaning an example would be if a patient gets a hip replacement, every participating discipline who's involved in that care, they share in that bundle, right? So everyone's taking from one pool of money. The issue is if that patient hits every goal, every person that's participating generally gets a good portion of that bundle.
Okay.
The problem is if that patient's in our facility, let's say they're at a skilled nursing facility, 2 weeks longer than we anticipate they would be there, and the first person they're going to look at to say, okay, well, we didn't find that to be reasonable, so they're going to take money back a lot of times, and this can happen in 2 weeks after that patient's left the facility.
Right.
It can happen 6 years after that person leaves the
Yep.
facility. They may do an audit, and Medicare may say, oh, remember that one time this patient was in your facility this time? Yeah, we knew that you guys said it was going to be there for 2 weeks. It was actually 4, and now that we're looking back at documentation, we really can't justify it. So we want that
Money
portion of that bundle back.
Okay, so is the term set upon the facility that house these people in? When they initially come in, they say, okay, we're estimating these people to be in our facility these many weeks? Or is that a range too?
It's a
So
range.
that's a range, because if they come in when they come into the facility, they come in with a diagnosis from a doctor, usually from a hospital when it comes to a skilled nursing facility. That is set on their diagnosis, that range. When therapy gets involved, then that can be extended to a longer period of time. But still, that small window, let's say roughly max 30 days, is all we got to get you back up. Back up and going on. Right, very optimistic.
I mean, honestly, right now they're like, okay, you can go home with home health services. However, home health is even limited now
to 6 visits.
Or 3 visits.
Or 3,
wow. And you have to think about it. These are elderly people. They have stairs. You know.
Most
I mean,
houses.
we're thinking about our needs right now because we're therapists.
Wow.
You know, or think about the patient who wants to go back home independent. They want to drive again. They want to work again. I mean, nobody wants to have someone drive them somewhere or take them anywhere. So honestly, I don't think our patients in the time we're given are able, a lot of them aren't able to return fully to their prior level of function.
Okay.
Yeah.
But we're at some point where we're thinking, or at least the insurance company is thinking, that they are basically at some type of normalcy. That's what the illusion is, correct?
What is called is the next level of care. So let's say first level of care is at the hospital. The next level of care up from a hospital is a skilled nursing facility. The next level of care from there is an assisted living facility where somebody comes in and still helps you, but you really have control of your own meds and you can still do a little bit of finance. Then the next level of care from there is independent living facility, where literally somebody comes in every now and then and helps you continue, make sure that you're safe, you're okay. Next level of care there is just at home independent. It doesn't mean you have family. If you don't have any family, that's not really their concern. So we definitely, all 3 disciplines, definitely from the day you walk in our door, we ask you questions about what is your end-game goal. Like she spoke on, if you're homeless, well, the end-game goal is totally different. We're going to try to find somewhere for you to live, get you to be maybe property of the state so that you have somewhere to live. Because, again, you still have an amputation. You still have something that needs to be taken care of. If it gets infected, you get sepsis, you're dead on the street, and it's because you didn't have proper care.
Correct.
So we always focus on what is the end game. And
so basically, if I'm hearing correctly, all 3 of you guys do what you do, but you also go the extra mile to take care of your patient, because I'm hearing you talk about you all set up for living facilities for if you're homeless, so you try to get them to the state. I'm hearing you talking about sometimes you have to take the extra step to like go into their homes with other
Other therapies.
Yes, other therapies. And I'm also hearing you speak of that in a whole, that you guys or you take care of the patient beyond just the hospital realm. Okay. So with that being said, do y'all really enjoy y'all jobs? Because I mean, this seems like a lot.
Oh,
It's a lot.
I think therapists are a special type of people.
I agree.
Because of the fact that there is so much. There's so much all the time happening. Like, it's not go to work, it's going to be the same as yesterday. Yeah. Every day there's something new. And I would say most of us get bored if it's the same thing every day. So we love that we're so involved. And we're so involved in so many people's lives at the same time. So I think for all of us, we're that type of individual.
Work.
We love it. It's work.
But I think it's worthwhile work.
Yeah, we get to see our outcomes. We get to see how good we help other people, how much we put in.
And they come back.
They come back and thank us.
They come back and they look for you, and they come back and it's like, I'm still walking, or look, I'm eating chips now. You know?
Yeah.
Or I had a patient one time, she was like, guess what? I remember I put my teeth today, you know?
Right.
It's no fun having somebody look for their teeth under the bed every day, you know? So I mean, honestly, it's great because these are our grandparents in a way, you know, or our parents, or this could be us one day.
One day.
So it's good because I sit back and say, okay, Toy, you don't need to eat that extra salt today, you know, the stroke is coming on down the line. I mean, you know, or
You do.
I'm paying attention to how I'm walking up the stairs because, you know, I need this other hip, you know.
When you go buy a house, no
Okay.
second level. No,
I wanna
I'll
walk
get
that
that
one in
first
the
level, one
Yes.
level, so I can live in it forever.
We work together. I think as therapists, we're like, okay, I know if I need help with sequencing or pivot transfers,
Right.
or, you know, I mean, dressing and things. I mean, we work together. So.
That's good. That's good that you guys actually do work together. And I'm quite sure you all have other colleagues and friends that you guys call upon to get some snippets on how to handle certain
yeah.
situations.
Right.
Oh, yeah.
That's always fun. It's a plus to pick up the phone. Hey, I got a situation going on. How can I handle this? I've tried this. This didn't work. So, of course, being in the field that you guys work in is phenomenal. I mean, it's amazing that you guys do so much for the community. I am very honored to be sitting next to the three of you guys, because just listening to all these amazing things, and even talking about the insurance and how they're making all these cutbacks in the state of Georgia. And I'm not talking about any other states per se. I'm just talking about here in Georgia, what they're doing. Some of the things I've heard through the pipeline myself, but I'm glad you guys were able to express it, because it does affect everyone in the community. So in case you might not have fallen, broken anything, or had a kid that had problems, but guess what? You might have family members, or you might have it in future-wise, things of what we're talking about right now. So this show will definitely be for you. You can always go back and play it and listen to what they're telling you, because everybody deserves help, and our insurance company seems to not really be focused on the longevity. They want us to be on robots, and unfortunately we're not robots. Everybody was uniquely designed, and we were put on this earth differently. So no two people have the same DNA. We don't have the same body structure of what's going on with our bodies. I mean, I know mine's hit a pivotal point of plus 40, and it said, nope, we're gonna do something totally different. So for me, I've watched that change. For kids, they grow up so fast, and their bodies and minds and bodies just change so rapidly. And then you look at our wonderful seniors. They served their time. They've done all the amazing things. But again, they've served their times, and their body is changing. So again, I want to thank everybody for coming on and at least telling what they do. But I want to go a little bit deeper. So who's going to take the floor on that?
Ooh. What do you mean by a little bit deeper?
Define deeper.
Yeah.
Oh, you want me to define deeper?
Right.
Yes.
I want you to express deeper. So what are the things that, some snippets, now I'm gonna say snippets, that you normally wouldn't hear, what they need to do being proactive? What's on this?
You mean in terms of, okay, so let's say, I get this question all the time. Folks ask me, what's the best nursing facility if my loved one needs to go somewhere? And my answer is it's the one that you can spend the most time at, right? So you may go to one that has a really good rating on Google, but it's 40 miles away from where you live. The best skilled nursing facility becomes the worst if you're not there to make sure that your loved one's being taken care of.
Okay, so how would I go about finding what's best? Because I know first you got to look and see what your insurance company say,
Right.
And that determines like how much you can spend, because they set guidelines,
Right.
And then after that point, they send you a list of places I need to go to or check out. So how do I take the first step, and just like, what are some of the questions? What would be the questions in which I ask, is this facility right for me?
So just to let you know, so that they don't give you a list. So once you come out of a hospital, they say, okay, well, you need to, for you not to have to pay some money back, you have to go to a skilled nursing facility, right? They tell you got to stay there for a minimum of 3 days, or you owe them money back. You can go to any skilled nursing facility.
Okay.
It does not have to be a specific one, okay? So
Well,
that's where you were taking over.
Medicare has a website,
Okay.
the Medicare.gov, and the hospital, I work at one hospital, they will give you name a few, but they can't tell you, hey, to go to this specific
Correct.
one.
Right.
Correct.
But I tell my families, I'm very honest, go to the Medicare website and look on there and see which facilities, may have, had tags. You want to know which facility have had tags, whether the food was too cold, or patient may have claimed that nobody nobody changed them in time.
Okay,
They
can I
didn't
stop
bathe
you
them in
one
time.
quick second? You said tags. Break that down.
So some facilities may have a tag. I'm very honest.
Yeah, tell the truth.
So
Tell
they
them,
may
let
have
them
a
know.
tag, and a tag is pretty much every year. Let's say Medicare comes in and they audit the facilities.
Okay.
And they want to look at how long it takes you to go to that patient's room when they push the call button.
Okay.
Because the patient hits a call button, they summon the assistant. How long did it take you to respond to that patient? They want to know how clean the patient room was.
Okay.
They look at patients' bed sores.
Okay.
They want to know that they come in with one, or how long had they been here before they received the bed sore.
Okay.
They want to know. Like I said, if the food was cold, they want to know if the patient feels they're being neglected. They want to know how the family members feel about that patient. They want to know if you're engaging the patients in day-to-day activities. Most facilities have calendars and activities.
Okay.
So pretty much they've been auditing rehab. They're looking at our documentation and what we're doing. So if you go on the Medicare website, you're going to see the facilities, and it's going to tell you actually what number or, what their rating was for that particular audit on that year. And we get audited every year.
Okay.
And you want to know, because this is your loved one, this is your family, this is you one day. I tell all my family members, check on your family member, make sure they're okay.
Yes.
Yes.
Some of them, I have patients that honestly, I walk in the room and they're like, who am I? Where am I? Because they're in the advanced state of dementia. They can't advocate for themselves.
Right.
So you need to advocate. And as therapists, I really think we advocate for our patients. I mean,
Yes.
honestly, I would go up on the weekend just to speak to certain ones that I've just gotten that attachment to. These are our patients. We go above and beyond, but not getting off topic. Look at the ratings. Look at if they had tags. Ask around. I tell or if you want to go, get a tour.
Yeah.
All
Perfect.
facilities they give you a
Perfect.
tour, and when you take that tour, even though they're gonna show you around, see through another lens is what I tell family members. Don't just say, oh, I see that wall and it's white. Observe.
Good.
Yeah, I would tell any family member, make sure you're able to be present and available for your family. So you may go to a facility that may have had no tags in the last 3 years, but that doesn't mean they're treating your loved one well. You don't trust those people, so to speak, just on their word or their reputation, right? Be present, be available. And that means you may have to have your uncle and then your aunt come by one day, and then you may come visit on weekends, but be present and available for your loved one. More than anything else, a really bad facility becomes amazing when you're there available to watch and observe the kind of care that your loved one's getting. So just because a particular facility has a bad rating doesn't necessarily mean it's the worst facility for your family member. You have to kind of be present and available, and if there's a problem, be upfront and open, and there are ways and means that you can complain about things. Know who the administrator for that facility is, right? Know the names, and just, more than anything else, be observant. If you know that your family member is supposed to be getting therapy 5 days a week, be there and make sure that it's happening. That's really the best thing you can do in that regard. You just be present.
And attend the meeting, the meeting we have for your patients once they come in.
It's a family
Care plan.
care plan meetings, and then the facility itself has meetings where family comes in once a month and say, hey, can we make these changes? Because you can always suggest, no matter what facility you go to, you can always suggest changes. If it'll help the facility, if it'll help your mom, dad, family member that's in the facility. When you ask to go deep, one thing that I see all the time that I advocate to family, please make sure that you change starting today. If you have a family member, any family member, make sure they hygiene and make sure that they have some kind of daily activity, okay? Because when we get patients in, this didn't just happen overnight. It didn't just happen yesterday that these patients had complications. We always get patients and I'm like, hey, how long has that thing been growing there on your leg? 2 years. Nobody knew about it. But that same thing could be, the same abscess or, whatever it is. It could have been, right, it could have been the cause of later on when you had sepsis. Or a very, very simple thing is, let's say you got a growth that's on one side of your body, or too much weight that's building up on one side of your body because you have edema, you have all this fluid that's building up on one side of your body, and then you have a fall. By the time they come to us, they're like, oh, they had a fall in the bathroom. Well, there's a reason they had a fall in the bathroom. It wasn't just because they had a fall. There's always a contributing factor what causes that problem and that issue that brings you into us. And so I love to say, hey, make sure that your family is taking a bath, and make sure that they, are having day-to-day activity. And I'll add in there, make sure that they're going to the doctor. I hate patients, family members that say, oh, they've been dealing with that for 3 years. Well, when did they go to the doctor to get it checked out? This is what causes issue is denial. There is an issue. There is a problem. Go get it checked out. That doesn't harm anybody to go get it seen about.
Okay, so you went into deeper with me. I want you to spread some nuggets to our audience in regards to pathology and what should you tell your the parents. What could you tell the parents to get them to know they need to be reaching out to you? And then I also want everybody to tell how can they reach you. So we're going to start with you first.
Okay. First with parents, I think early detection is best. A lot of parents notice their child may not be speaking or saying any words or not babbling and cooing, and I think parents believe they're in denial, I would say a lot of times.
Yes.
But I believe that if you are able to tackle it head on, then we can kind of eliminate prolonged deficits. So I would tell all parents, go on and get that hearing screening and, speech screening, because sometimes maybe that child needed tubes in their ear.
Correct.
So I tell parents, don't look at it as something's wrong with my baby. Look at it as though I am now looking into their future and I'm helping them excel. So I think early detection, screenings, speech and hearing screenings. As far as my geriatric population, I don't like it when people say, oh, well, they just have dementia, to kind of throw them to the side.
Right.
And I'm one of those people, I do understand. However, we do have to understand that these are still people.
Yes.
And we have to understand that we need to understand where their current level of function is. Because one thing about some of our patients, if they made a cup of coffee every day, that's never going to go away.
Right.
They may forget how to turn it off or unplug it, but they're not going to forget how to make it. So I definitely believe that there's nothing wrong with continued services, home health, even though that patient has long-standing dementia. I think for me, preferably looking long-term with our patients, I just think I'm just going to say therapy as a whole, because sometimes we don't want the therapy, or sometimes we say, oh, we'll do it later, but we always say that if we start early, head on. And honestly, because when people wait, it gets worse. Just like you said about the abscess, it gets worse. When something happens to your body is telling you something's wrong. Let's get it checked out now.
Yep.
But we ignore it because we're scared of the diagnosis or what the outcome is.
Okay.
I work with all settings. My youngest is probably 1, and the oldest is probably 90.
Oh, wow.
Yeah.
That's a broad range.
Yes. I think it's great to be a speech pathologist that works with, all ages. And can tackle any deficit. You can reach me at ldhroberts@gmail.com. You can also find me online. Dynamic Pathways to Speech is my company. I also help young women pass their praxis, which is the test to be a speech pathologist, as well as how to excel once they've passed their tests, and just how to just enjoy and be cultivated and have a firm understanding of what it means to be a pathologist, the etiologies, and the characteristics.
Okay, so I heard you give them all your professional sites. What about your social media? Are you on social media?
Yes.
Okay.
So it's just Latoya Roberts on Facebook, and it is Miss Toy Dominique on Instagram.
Okay. And Mr. Rivers?
Oh, what you need? I would say this too. I know a lot of younger folks, particularly athletes, and a lot of folks who've been post-op surgeries. Opioids is a big issue in this country nowadays.
Yes.
And I do want to kind of, there are alternatives to pain management, and PT is a big piece of that pie. there's half the population at some point is going to be dealing with back pain.
Yep.
Yes.
And there's a lot that are really skilled
Yep.
and knowledgeable physical and occupational therapists can do to address pains. You don't necessarily have to just, there is a push, and that's lowering down now. But at some point, there was a push. Oh, you have a back problem? Okay, we're just going to do surgery, and here's this oxy for the next 3 weeks. And then,
Right.
we have folks 6 years, 10 years down the line who have an addiction and in a position where they never had to be. So I'd advise anybody go to the American Physical Therapy Association website. That's apta.org, and you can look up therapists in your city who are certified as orthopedic therapists who can address pain in a meaningful way where you don't have to necessarily use opioids as a way to deal with pain. So I think that's important for me to kind of put out there.
And how will we find you?
Me, I'm new to the social media thing. But you can find me on Instagram.
Oh my God, you're new?
I'm not
As a
new.
millennial?
I'm not new. To be honest, I don't use it that often.
Right.
Okay.
But I'm getting better at that. So if you do go to my Instagram page and no post, I'm working on it. BMARRASTDPT. That will be my Instagram handle. And Facebook, Barris Morass. You can find me on Facebook. Yeah, that's all I got.
Okay, and last but not least, sitting to my left is my one and only number one son. He is my firstborn, Mr. Kirk Wright. What are the nuggets that you would like to leave everyone, and how would they reach you?
Again, like I said, I have to reiterate, if you're taking care of a family member, or if you are the only responsible party for a family member, or if you have a large family, everybody should be calling everybody. If you have a neighbor that you're close to, and they don't have any family, community should be communities again. Get to know your neighbors, because you never know when, something happens to you. They say, hey, I ain't seen him, he can go to work today. I know he goes to work today. Let me go over to his house and check on him. And then that's when they find him, on his living room floor because he fell, but he never was able to get back up. And I've had clients like that as well. They finally come into a facility. They say, well, my mom fell on the floor. She was there for 3 days. Well, nobody checked on her for 3 days. Luckily she was alive, but worse could happen. So with family, with friends, with neighbors, please get to know them, call them, make sure that they're getting out, that they're getting about, that they're doing something. I don't care if it's walk around the block, make sure that they hygiene, because again, poor hygiene starts a lot of complications.
Correct.
A lot of complications that lead to worse diagnosis that causes, death or necrosis, amputations, funguses. You don't want any of that.
So how can we possibly reach you?
I had to look it up because, like Barris,
I'm gonna get better at it.
You gotta have time.
Yours.
You gotta have time. So mine is JAG JAG_lover1. You can find me there on Instagram. So if you have any therapy questions, believe me, you can contact me definitely on my Instagram. I'll answer them. If I don't know them, I'll ask anybody, any speech therapist, any physical therapist. Hey, what do you think about this? Hey, what's a good recommendation for a facility? Definitely whatever's close, like Bear said, whatever's close in your area. What's a good recommendation for home health? Look at all the companies. Call them, get to know them. Some therapists do have their own practices. They can come out and see you directly if you have a personal choice of who you want to see you.
Okay. So again, I want to thank you guys for coming on the show today
Thank you for having
being
me.
a part of Let's Talk Therapy. I enjoyed you giving valuable information to our community, and I look forward to one day again being able to sit with you again and
Anytime.
get an update on everything that's going on. I look forward to seeing you guys again on some ventures of next year as well. Again, you guys, don't let your dreams be snatched away by dream killers. And I want to thank everybody that joined in. So if you have any questions in regarding today's show, they have already given you their information. I want to tell you again, thank you and love you, and bye. Mwah.